DW's view, stand up. If we do not stand up for what we believe, who will? My sponsor is Kim Yater. She is an awesome lady. She has a peak performance. She's a peak performance coaching. I just want to encourage you today. If you have any problems or any situations in your life that just don't seem right, you just can't make it through, then you need to contact my coach, Kim Yater. You can contact Kim for a free complimentary strategy call. Personal coach, Kim Yater. Contact her at Calendly, calendly.com/Kim Yater. This is the day that the Lord has made. I will rejoice and be glad in it. Welcome to DW's View. Stand up. To my audience, I want to thank you for coming back, for joining us one more time. I really appreciate you watching and listening to these podcasts each week. And today I have a very, very special guest. And my guest today is Dr. Marilyn Singleton. Dr. Singleton is a board certified anesthesiologist and immediate and past president of the Association of American Physicians and Surgeons. She graduated from Stanford and earned her MD at UCSF Medical School. Dr. Singleton completed 2 years of surgery residency at the University of California at San Francisco Medical Center and her anesthesia residency at Harvard's Beth Israel Hospital. She was on facility at Johns Hopkins Hospital in Baltimore, Maryland, before returning to California to private practice at Cedars-Sinai Medical Center, that's in Los Angeles, at Alta Medical Center in Berkeley. While still working in the operating room, she attended UC Berkeley Law School, focusing on constitutional and administrative law. She interned at the National Health Law Project and practiced in insurance and health law. Dr. Singleton has published numerous articles, presentations on health policy, and had many radio and television appearances. She started a blood pressure screening clinic at her church and makeshift clinics in 2 rural villages in El Salvador. Dr. Singleton ran for Congress in 2012. Please help me welcome Dr. Marilyn Singleton. Good morning, Dr. Marilyn. How are you today?
I am just fantastic. I'm so glad to talk with you this morning. It's great.
Oh, thank you. The pleasure is mine. It's all mine. And I'm so thankful that you agreed to talk to me and to my audience. I wanted to get someone with a medical background. And I said, well, what better person? I said, all I can do is call and ask her. And thank you for coming today. I really appreciate it. So I want to go ahead and get started. I always like to start out, let my audience know about the person I'm interviewing. So I want to know why you chose to go into medicine, and while operating in the medical room as though you weren't busy enough, you still attended UC Berkeley Law School, focusing on the Constitution and administrative law. Can you share with us?
Well, I have to say, I come from a family in medicine. My mother's father was a doctor in a small town in Ohio, Lima, Ohio. Go Lima. And my father was a doctor. And so I grew up with it. And I remember he had a service that transferred the patient telephone calls. And I remember growing up that we'd hear him talking on the phone to the patients. And I thought, I'd like to do that too.
Oh, okay.
So when I was in high school, though, I got interested in politics, and I thought, gee, law might be kind of good too. But medicine, I thought, would be much more interesting, and indeed it was. And I thoroughly enjoyed every single minute, even the horrible training, being up all night every other night. it all was great. But then interstage left Hillary Clinton and her health plan, and it just seemed so horrible to me. I thought, I want to know how they make these laws. I want to know what they do.
Okay.
And as I told myself, if I get into UC Berkeley Law School, that will be the sign from above that I was supposed to go, because it was about 7 blocks from the hospital where I was working. So I thought, okay, I can do this, that it wouldn't be like going across the bridge and, going into San Francisco, whatever. So I got in and I said, okay, I was meant to do this. And I did. And that's that.
Amen.
So
Well, what a blessing. What a
yeah,
blessed career you've had.
thank you.
Yeah.
Thank you.
Yeah.
I'm just glad for everything I've done and everything I've learned, all the people I've met. It's fantastic.
Yeah, that's great. God has a path for all of us, and we just have to let him guide us. And again, a blessing. Now, I want to get into some medical things, especially talking about COVID. There's so much news about COVID. So we'll spend a great deal of time talking about that. What is the benefit of taking the COVID vaccine? And some people say that the COVID deaths continue to rise. Some say it's going down. So what's the truth? And what happened to the flu season? I haven't heard anyone say, oh, I got the flu. I haven't heard much about flu this year at all since COVID. I'm just curious about that.
There's a whole lot in that question. It's just like, one, I think we have to understand what COVID is, how it works, how it came about. COVID is the name of the disease you get from the virus that's called a SARS virus. We've had a SARS virus before, and it's a coronavirus because it's got those little spikes around it. So corona means crown, and so that's where it comes from. There's 5 coronaviruses that have been circulating around for a long time, and that's what gives us about half of our common colds. So we know about these viruses. This one was different, and we can wonder why, whether it was developed, whether it came naturally. Many people think it didn't come naturally because we don't tend to have as much immunity to it. Just like we develop over the years immunity to colds just because you get them. And viruses always mutate. They always change. That's what they do. That's how they stay alive. Viruses want to live, and they need a host to stay alive. They can't just float around the air and stay alive. So they tend not to want to kill the host, but they take over the host. So that's kind of a little bit of virus history. So here we have the novel coronavirus, this SARS virus that causes the disease of COVID-19. And it appears to be following a curve that was developed all the way back in the 1800s with smallpox, a guy named Dr. Farr, Farr, if anybody wants to look it up. And it's called the Farr curve, which is kind of like your normal bell-shaped curve. What goes up must come down. And it looks like we're on the downslide of that bell curve. And that started happening well before people were vaccinated, and we only have a small percentage of the population vaccinated anyway. So it might just be the natural progression of the disease. Now they're talking about these variants. Well, the question is, are the variants more harmful, more infectious? Do they make people sicker? It's all unclear because there's multiple variants. There's several that they found already. We have, I think, about 3 right here in California. Then there's South African, the UK, South American, all these things. Why that becomes important is people say, oh, now we have a vaccine to the original COVID, and will it work against the variants? Well, a couple of the vaccines do, and a couple of them don't, or they work very, very little. So what good would they do? So then you come down to vaccines at all. What does the vaccine do? There's several kinds of vaccines that are in the pipeline. And they all have been developed in different ways. The one that most people are getting now is this so-called messenger RNA vaccine, where they slip something in an RNA, which is what gives instructions to cells as to what to do, what allows cells to do their job. And it makes that little spike protein that's the infectious part of the virus. And so then we make an antibody to it. Well, that, and I almost hate to use the word vaccine, I have to call it a medication. It doesn't stop you from getting infected with the SARS virus, but what it stops you from getting is a severe case of COVID. So they say it's 100% effective in keeping you from getting a severe case, 95% effective in keeping you from getting a moderate case. So you might get COVID, but it'll be more like a cold and you won't get sick and presumably not have any long-lasting consequences, certainly won't have to go to the hospital. And so that's what would help everybody. We won't be getting sick. So that's the principle.
Yeah, but there's no way to know what the long-term side effects are of these virus, these vaccines that they're putting out. No way to know that, what the side effects. And that would be something that I would be concerned about. What is the long-term side effect? And of course, no one knows.
That's right. And that's an excellent question. And in fact, just today, I read a study that was directed toward minorities because everybody was saying, oh, minorities aren't getting the vaccine and stuff. Well, it isn't necessarily because of racism and hatefulness toward Black and brown people. From the survey, it was like 41% of, if you take men and women more skeptical than men, of Black women say just what you said. I want to wait and see. I want to see what happens to the other people. That I don't want to be the first one on the block. And a lot of people are feeling that way because the various adverse effects are starting to come out. Yes, there may be, as far as bad reactions, they're probably about 5 times more than you get with the flu, but it's still about 5, 6, 7 per million doses of vaccine. And you say, well, that's not so bad. But then there's other things that happen, some neurological problems that are starting to pop up. Again, not tons, but enough that would make somebody say, let me wait after more people are vaccinated and see what my particular medical condition is that might make me not a good candidate for that vaccine. And the thing that people have to remember, and what I would certainly let people know, if you've been doing okay, depending on your own particular circumstances, what you're doing with your life, with your job, if you have kids, what your age is, all this, that's how you can make a decision. But there's other vaccines that are more like true vaccines that are coming in the pipeline that are in the process of getting an authorization. And personally, I'd rather wait for the standard vaccine to come out and then consider whether I'd get that. And what people have to remember, and I think this is really important, especially for Americans, because other than Tongans and Samoans, we're the fattest people on earth. And so many people wonder why we have a high COVID rate. Well, there's a lot of reasons, but one of them is our obesity. Other than age, because age is the #1 risk factor, obesity is the second biggest risk factor, and then diabetes and high blood pressure. And that's, excuse the expression, huge, because we don't take care of ourselves. And, it's interesting in the beginning, you talking about Kim and helping improve your life. And we kind of feel that way in medicine, that we have to focus sometimes on the bigger picture and not something narrow, even though COVID seems to have overtaken everybody's life now. But the big picture is we're not a very healthy nation. Even though people have access to food, etc., that people are having that box of mac and cheese before they're having a salad with lemon juice. And
Yeah, that's
so,
true. That's something for people to think about. So that's kind of why I wanted to bring you on, so that we could have a expert opinion and get some good information out. It's really a blessing. Now, wait, when they talk about herd immunity, do you think the United States is reaching herd immunity?
well, and again, in fact, in just the last couple of days, several of the epidemiologists have said that they think we're about to that level and could probably be there by April. Some countries look like they've already managed that. And what we have to remember is that the estimates going all the way back to the early cases on the cruise ship, the Diamond Princess, where they had
Yes.
a true scientific group of people, because they were all trapped on,
Mhm.
on that boat,
Yeah.
and saw who tested positive for COVID, who was sick,
Mhm.
and who died. And early on, it's like it goes right back to that. It was the older person that died, and they had about 40% of the people tested positive for the virus, but they were not sick. And that seems to have held true, that about 40% of people have had the virus, but were never sick. So if you look at that and look at the numbers of the people who are recorded as having had a case of COVID, and then imagine on top of that, 40% have tested positive for the virus, there's a lot of immunity out there. And I only hope that it's true that there are models that by April, there would be the so-called herd or community immunity. And we have to remember our immune systems are very good. And it's one of the reasons that children tend not to get sick from it. They have very strong, it's called T cell and B cell immunity. This is your long-term memory of everything that's attacked your body. These cells remember it. And if you have strong memory cells, then they will fight the disease off. And that's the problem, excuse me, with the old and frail, or just frail, even if you're not necessarily old, that their immunity is low. And so they can't just fight things off with their natural immunity.
Yeah, I was listening to the radio this morning, and there was a gentleman who called in. His wife, of course, elderly, she caught COVID, got very ill, was put on a ventilator. And even though she was in a critical state, they put her on hydrochloroquine. And he said his wife, literally, it really saved her life. And then there was another case where a lady said there was a group of them. She said, we all got on hydrochloroquine and ivermectin, and they're staying on it. And the doctor said, well, do you want to take this? And they said, yeah, if it's going to help keep us healthy, then you give it to us. So they were able to get a prescription from their doctor, and that's what they're staying on as a preventative, to keep themselves healthy. And I want to move on to the next question. So we talked about the benefit of taking the vaccine, and we know that some COVID deaths, I mean, you talked about that. What would you attribute the deaths labeled as COVID? How do you think that a lot of the people are dying? They say that they're dying of COVID, but some say not everyone who's labeled as a COVID death is COVID. It seems like everybody who dies, they're labeled, for the most part, majority of them are labeled as COVID. Why is that? And I know money is a part of, for one thing, but other than, why would you label even people who didn't die of COVID have been labeled as COVID deaths?
It's That's an interesting question, and you can kind of parse that down into a couple of answers. That yes, we have certainly discovered that anyone with a positive SARS infection was someone who died with COVID. And that doesn't necessarily mean that they were sick from COVID. They just had a positive test. And as we just
Mhm.
discussed, 40% of the cases are asymptomatic. So those people, probably COVID had nothing to do with their death. Then you have a category of people who, let's say they died from heart failure. Um, One could argue that because they had COVID and they were already had some underlying illness, that the COVID sort of pushed them over the edge. So there's that group of people. Then there's the group of people who actually died because they had an overwhelming infection with that virus. Parsing that all out now, it's hard to know these numbers because initially the CDC just put out all the numbers of anyone with a positive test died of COVID. And that's how they call it coding, where you put an actual code for the reason someone died. Well, now that that's been exposed, people are starting to separate that out. And I'm sure in a couple of months, assuming it's not squelch for some reason, that we're going to start to get some true numbers.
Yeah, well, that's good, because I get the feeling sometimes that there are some people that want to keep us on on this train forever. And to me, it just seems like more government control. And I don't know. I was looking at the World Health Organization. They were talking about, where did COVID start? It didn't start from China. It came from frozen food. I said, wait a minute. That doesn't even make sense. I'm not a doctor. I don't even pretend to be one.
Well, I don't think that made sense to a lot of people.
Yeah.
And you can come up with all sorts of theories and whatnot about COVID, and whether it was a bioweapon or this, that, and the other. But one of the things that you see, it seems to go back to the original. It came from somewhere out of China, and whether it didn't act normal, how viruses do jump from animals to people, but it seemed kind of to happen too fast. And that's kind of one of the reasons that it's hitting people harder, that it didn't just evolve. And so we got a little of it here, a little of it there, that suddenly, bam, we were hit with this. And if anybody believes anything China tells them, then, how does that expression go? I have a bridge in Arizona
Yeah.
to tell you that a lot of their studies, we don't know if their numbers are right. And are we going to do what China did? Just, 3 or 4 days ago in the New York Times, they had this glowing article about how China came back from COVID. Well, what did China do? Welded their people into their homes. And are we going to do that in America? And did China really come back? How do we even know?
It's no way to know coming out of China.
That's
We'll
right.
never know the
It's
truth.
closed.
Yeah.
They tell us what they want us to know.
Yeah.
And this is the scary part, is that we're becoming that way
Yeah.
with all this censorship that's new.
Yeah, don't get me started on that. I talk about that every week, how American citizens, it's not even like America anymore this year. It's like we're turning ourselves into a communist country, and we're being led that way. And that shouldn't be happening here in America. Our Constitution is like being trampled on. Our God-given Constitution and freedoms that Americans have always enjoyed. And I say all the time, don't take your freedoms for granted. And I say that every week, just about how things are changing, and some people don't want to believe. And some people have a way of saying things maybe not so flattering, but yet they're truthful. And sometimes you have to say something kind of crazy just to get people's attention, and hit them over the head with it. And then still they kind of get a little angry at you and get mad at you. But there, I mean, there's some bad things happening that should not be happening. And
Well, it's like that old expression, boiling the frog, that if you have him in the water and then gradually turn the heat up, he doesn't know he's getting boiled, versus if you throw him in the already boiling water. And that's how COVID, I believe, and I want to make this clear, it's a real disease, it's a real problem, and people are dying. And it should have been left that way as a medical issue, just like cancer is a medical issue. But somehow it got turned into a political issue, whether it was the year of election, whether it didn't matter if it was an election year, that just because people are irritated with President Trump, whatever the reason, a medical issue became political.
yes.
And started getting us to depend on the government, get used to the government telling us what to do. And that's the part that bothers me, to see people blindly just saying, okay, I'll do that.
Yes.
I'll do that. You told me I'm going to die if I don't do that. I'll do that.
Yes.
But it made no sense, because on one hand, they tell you you're going to die, you're going to die. But then when somebody comes up with hydroxychloroquine and ivermectin that helps people not get any sicker than the early stage and keep it just like a common cold, suddenly people are squelched. Suddenly their Senate testimony is erased from YouTube. What is this Pravda? Is this communist China? The Soviet Union? I mean, my goodness.
Yeah. Yep. Well, thank you for saying that. Now, I wanted to, just for the sake of the people that listen to my podcast, can you tell people what the symptoms are of COVID? And if taking hydrochloroquine, ivermectin, those kind of things, vitamin C and D and zinc and all those, D3, do those things really help prevent or protect people from coming down with COVID? Do they help protect the immune system?
Okay, first, starting with the symptoms. Some of the symptoms really can be just like the common cold, but there's a few things that seem to be more specific to coming down with COVID disease. Headaches seem to be more common than you'd get if you were having a cold. And interestingly, the loss of smell and taste. That's what's tipped a lot of people over the edge, that say, okay, I think this is COVID and not just a cold. So, but fever, muscle aches and pains, less so sore throat than what a lot of people tend to get in cold. A cough, and a cough tends to linger. Taking hydroxychloroquine was put forth months ago by a doctor in New York and a doctor in France, that they did this so-called empirically, just real world medical evidence. They didn't do a study, but found that the patients who they put on hydroxychloroquine early did better than people who had nothing, because the CDC tells you if you get those symptoms, just stay home and drink a lot of fluid and get some rest, just like with the cold. But because the COVID disease, the virus that causes it, is more infectious and really burrows into those cells more, you do have to treat it early before it can burrow into so many cells. And this was the point that many of these doctors are making, and found that to be the case with their patients. As soon as they gave them, and early on, it was hydroxychloroquine that they discovered. And many places around the world, they've given people these packs of hydroxychloroquine and zinc, and tell them if they get the symptoms, start taking it. Now, as the months went on, another drug was discovered to work, another anti-parasitic drug, hydroxychloroquine. Um, it was developed as an anti-malaria drug, and now it's used for people with rheumatoid arthritis, systemic lupus, people with autoimmune inflammatory diseases, um, and used very safely. So we're talking 70 years of safe usage of the drug. There's another drug called ivermectin that's another anti-parasitic. You give it for scabies and certain worms, and people have been taking that for years. Well, it turns out that tends to work after somebody has symptoms. It doesn't seem to work quite as well as a preventive, but hydroxychloroquine seems to work better when you're using it just prophylactically. And healthcare workers in many countries are taking it prophylactically since they're the ones right out there on the front lines. So all these drugs have a place in the course of the disease. But going back to what we talked about earlier about taking care of ourselves is vitamin D. Now there have been studies on vitamin D that show that people who have a normal blood level of vitamin D have a 54% chance of not developing severe COVID disease. And that's quite significant. And some people are making that correlation to the folks in the old folks' homes, because who are the ones who died? The ones who were inside these homes. They probably weren't outside in the sun. They probably were not getting vitamin D supplementation. Diets are poor just because frail people tend not to eat very much. And they were the ones dying. And so I'm lucky. I'm in Southern California, so I can go outside and get a lot of sun, but I still take a vitamin D supplement. Zinc supplements, because again, people have known for years that zinc helps combat viruses at the site when they're trying to go in the cell. And something called quercetin, which is kind of, it's not really a new kid on the block, but people are starting to know the word now. It's something called a bioflavonoid, and it's what's in garlic and onions, and it helps drive the zinc into the cell. So these are things you can do over the counter. And going back to talking about take care of yourself and look ahead, and they're not grossly expensive drugs, so people can afford to buy them and start taking them.
Yeah, now a real question now about that last one you missed, quercetin. Would you spell that just so people?
Quercetin.
Okay, so people can buy that over the counter.
Regular drugstore. Don't even have to go, to some fancy vitamin shop.
Yeah, I'd heard about one over the weekend. I was listening to a radio show, and I think that's probably what it was, but I couldn't get it because they didn't spell it. They said it so fast. They said you could buy it over the counter. It was kind of equivalent to hydrochloroquine.
It's kind of your poor man's hydroxychloroquine, that it does the same thing that the hydroxychloroquine does. It helps drive the zinc into the cell. And that's one thing about taking anything and taking vitamins, that if they don't get into the cell, then it really doesn't matter. And there's all sorts of things about how you take things, because some are soluble in fats, some are soluble in water. So there's a lot of kind of the little minor details that go into it. But if you take those things together, you can help. Nobody's going to say that's going to keep you from getting the disease. And a lot of times it has to do with actually the dose you get. That's where kind of the masks come into the picture. There's a doctor up at UC San Francisco who does a lot of work on viral loads. And even though technically one virus can make you sick, that generally doesn't happen. Usually it's a load, and it's like the difference of having somebody sit there and cough right in your face or sneeze in your face versus you just being in the room with them. One, you're probably going to get sick. The other, you probably aren't. And so the idea of wearing a mask would help you with these big coughs, big sneezes. But the problem is, and this is what I'd like to emphasize, that wearing a mask isn't going to protect from random stuff in the air. That's going to get through the mask. And even if you start triple, quadruple masking, which then you couldn't breathe anyway, so that's untenable. That if someone were to sneeze on you, you'd have to untie the mask if you have a tie or if they're behind your ears, take it like this, pull it where it kind of closes over, and quickly toss it in the trash. Put some hand sanitizer on your hands and put a fresh mask on. People aren't doing that.
No.
And after you've had a mask on for about 20 minutes, especially the thin cloth ones, they get moist from you breathing in and out. And any electrostatic effect that surgical masks might have starts to go away once they get kind of soggy. And being an anesthesiologist, I wore a mask, every day of my working life for hours upon end. Now I change the mask between every case just because you're talking and the mask kind of gets in your mouth and it's kind of yucky. So you just take it off. And if people are wearing masks all day, I would hope that they're changing them often and washing them in hot water, sterilizing them at the end of the day, but that people aren't really doing that. And so the masks have become more of a symbol than a useful item. And that's what bothers me, because they can be useful in certain circumstances, but they aren't the cure-all.
Yeah. So do you agree with everybody, the whole country being masked down, everybody wearing a mask?
No. That, and,
You can't go in the store, everybody, you can't come in this store and shop. If you don't have on a mask, you cannot do business pretty much anywhere.
No, and a lot depends on where you live, because there's some states where everybody isn't wearing a mask.
Yeah.
And what's fascinating is you can look at this with countries, with states, that there seemed to be no difference in infection rates, whether you were masked up or not. So again, a virus is going to do what a virus is going to do. And that brings you to your question about the flu, that there's only been 1,400 cases of flu reported. And part of it is people aren't going to the doctor and getting tested for the flu. So you don't know what you have, you just felt bad and it went away, and that's that. So that's part of it. A lot more people got vaccines this year since they were afraid of COVID, but fewer people are going to the doctor to actually get diagnosed. I'm sure one year I had the flu, and the doctor says, "Oh, do you want to get a test to see if you have it?" And I said, "No, I was fine." And so a lot of people don't get the blood tests to prove one way or the other what you have. And the fact that people are washing their hands and schools are closed. Kids passed on the flu. They tend not to be the ones who are getting sick from COVID, but they got quite sick from flu. So having schools closed really cut down on the transmission, and not having people go to work. And I think that's one thing that'll come out of all this, is getting employers to be more sympathetic to people who say, I'm sick, I want to be home. And, sometimes workers have done it to themselves by lying about being sick, but when you're actually sick, don't go to work.
Yeah.
And too often people are afraid to call in sick at work, and then they infect the whole office. So with people not being in offices, there's not the room for transmission. And you have to remember, when you say the flu is down, but you still have COVID, COVID is that virus, SARS, is more infectious than an influenza virus. Like, without going into the math on it, there's something called an R0 number. And the flu is only 1, COVID is 2. So, and it might even be 3. So it's twice as infectious. So if you're doing the precautions for COVID, then it'll certainly help eliminate the flu. But the biggest thing are our hands. Jazz hands, wash your hands.
Oh, great, great. I know they say that all the time, but we actually have to do it.
Right.
Now, the hand sanitizers now, are they, when you can't get the water, so I know they're out everywhere, are there some of those that are more effective than others, or they're pretty much?
It's check to see the percentage of alcohol. Get the ones with 70% alcohol, and
Okay.
and get real brands. It's so funny, when nobody had hand sanitizer, my son had bought one of the ones made at the bourbon factory, when everybody was jumping to make it. And he said it just wrecked his skin. Now I see hand sanitizer everywhere. So it seems like the production is back to normal. And so get, CVS brand, or, whatever, but a regular brand. Not, if you've never seen it, don't get it. Read the back of the bottle and see what percentage alcohol it is, because it's the alcohol that works. Other things that people should know about, again, that you can do for yourself. And now dentists are doing it. If you go to the dentist, as soon as you go in, they have you gargle with 50-50 hydrogen peroxide and water. And in fact, people have now come out with a solution where it's pre-made, so you don't have to guess and do it 50-50. If you gargle with that quells virus that's in your membranes.
Okay.
Yes, and now they're finding true Listerine, and they say Listerine, and I don't know the components of all the other mouthwashes, so they might be different, but this is from what we hear from dentists, that it's Listerine, the old-fashioned kind, the yucky,
Yeah.
but that gargling that can quell the virus that's in your.
Well, that's good to know.
Yeah, so I do that when I go to the store and come back, where I've interacted with a bunch of people. I'll just come back and gargle.
Yeah.
Again, I don't know. I can't give you a percentage of how much it helps, but it's something simple you can do.
Yeah. I'm glad you said that, Dr. Marilyn, because that's something people can keep in their car. And when you go in and out of different stores and stuff, just keep that mouthwash in your car. And matter of fact, I'm going to do that. I'm going to get some and keep it in my car. So when I go in and out of a different store, when I come out, just gargle my mouth out.
That's right. Do your hands.
Keep it in the car, and then you can do it right away. And I'm going to do that. Yeah, thanks for that tip.
Well,
now what about,
we all have to do simple things.
Yeah, but you know what? But then we have to know those things, and so that's why I'm glad you came on today, so we can know. And some people may know, but then everybody doesn't know.
Well, and one of the things that gets me is, we're hearing all this doom and gloom. You turn on CNN and you have all the deaths and the cases and the hospitals and on, but they don't have people come on and say what we're talking about. What can your everyday guy do to help yourself out? And I'm not saying it's going to cure COVID or keep you from ever getting infected with the virus, but everything in medicine, in life, is about risk and benefit. And
Yeah.
we do everything we can. A seatbelt isn't going to keep you from getting killed in an auto accident, but it greatly lessens your chances. And that's how we feel about these everyday things people can do with regard to catching anything, whether it be flu, COVID, or any other virus.
Yeah, well, that is great. Now, I see so many people who are fighting against being locked down, and I think it's time to take the foot off of these businesses because we've lost so many thousands of businesses across America because they've been locked down, and they're being arrested for just even safely operating their business. They've been put in jail, they've been arrested, their funds have been confiscated in some states. I mean, it's really very tyrannical what's happening in America with they have weaponized this COVID virus against the American people. And it should not be. How
Well,
can people survive if the economy people have to pay their bills and they're not even being allowed to do that?
oh, you're so right in bringing that up. And one of the things that I find quite curious is that these small businesses, small stores are shut down, but you can still go to Walmart and Costco.
Yes,
Nothing
exactly.
against these places, but looking at the big picture, it's like corporate and certainly Amazon thrived,
Yes.
but the small middle class entrepreneur failed. What's wrong with this picture?
Well,
And to me, it made no sense.
no, it seems like a deliberate effort to get rid of small business and herd got your herd back there. Herd everybody into the big stores and to get rid of the little guys. And I don't know, maybe I'm just kind of imagining things, but some just don't seem right about that.
No, but that fits in with the whole idea of more control. The big corporations have become sort of an arm of the government. Let's put it that way. It's that one step closer to having single people do things and get people dependent on the government money. And so the businesses are closed, they have to beg for money to pay some employees or to pay their rent, hoping they'll have a business when this whole thing is over. Then the next thing you know, it'll be universal basic income, single payer health care, on and on and on. It's like each step just primes the pump for the next step.
Yeah,
So I feel like we're being groomed for
yeah.
more control of big business and big
Yeah,
government, and
I
that's
think
scary.
so. Now, Dr. Marilyn, would you talk just a little bit more about the single payer healthcare? I've mentioned that before. I mentioned that, I believe, last week. Single payer health, the healthcare, and I kind of said it's kind of like what they have in Canada. Can you elaborate a little bit, tell people about the dangers of a single care healthcare, which probably somewhere be coming at us with a big force here in the near future?
Well, one of the things I think people have gotten a touch of a taste of this with private practice in medicine shrinking, that now only 47% of doctors are still in private practice and aren't employed or somehow associated with one of these big hospital systems. And so people had started to complain when they went to the doctor, they were getting 7 minutes with the doctor, which is totally unacceptable. But part of that is the big system. You've got to just march the patients through. And so again, bit by bit, people are getting used to, okay, this is how we're treated. Well, that's not how you should be treated. And even with electronic medical records, that gets you more in the system that, oh, everything's going into this great big system, not a quiet little chart between you and your doctor, and getting you used to the idea that it's not just you and your doctor. And with single payer, one of the things people don't realize is that you have one person who's authorizing procedures. Right now, you have multiple companies, the government, you've got to get pre-authorizations to do certain things. And if one person says no, you can move on to the next. And fortunately, if you have enough money, you can go to one of these private surgery centers and get your hip fixed for 1/4, 1/5 of the price than if you had to go through insurance. And more people are discovering that aspect. Well, guess what? If you have single payer, all that stuff, poof, it goes away. And when you read these bills, they say, if it's a service that you could get under the government, then you can't get it under private. It's really restrictive. And one of the reasons people come to America to get care is they can get it quickly. And there's all sorts of options. There's not just one option. There's not just one doctor they're going to send you to for whatever it is that happens to be wrong with you. And you hate to use the word rationing, but that ultimately happens because you only have so much money. And I don't like the idea of having big boy in the sky be the one who decides who lives and who dies. If you're old, hey, we don't need you. And it certainly, I think if we didn't learn a lesson from this Governor Cuomo scandal of the nursing homes to show how old people's lives basically are disposable, useless. I don't really mean that, but you know,
I know what you mean.
how they're treated. And first to go.
Yeah. Yeah, that is a horrible thing with so many thousands of people in nursing homes. Just why would you put people with COVID in a nursing home? And I would hear the nurse who broke this story begging for help. So we can't take care of the COVID people. They're gonna infect the nursing homes. But that governor of New York would not listen. And I know this is probably banned speech. You can't talk about these things, but the American people have to know. There's so much speech, so many things that are banned that you can't say, that you get kicked off of social media. You don't dare, you can't say that. Certain things you just can't say. And
well, I think this is something that's a fact and they can't say is misinformation.
yeah,
When it came to New York, President Trump sent that Navy ship out there.
yes.
It was in the harbor, and I think it was a
And
handful.
Franklin Graham was there with all those tents. He brought the whole hospital there. There was no excuse for that. They didn't even use those facilities.
Right. So they had somewhere to
Yes.
put people. It
Yeah.
just wasn't done.
Yeah. Let's talk about children in school. I think it's shameful what's happening to children. Of course, we don't care about now the education that they're getting is horrendous, the sex and all the stuff they're teaching our children. I talk about that all the time and I bring it up because some people don't know and some may not even believe it's happening. But the curriculum that's being taught to our children is horrendous, is ridiculous. All this transgender stuff and sex ed, pornography. That's what's being taught to children in school. But yet they're not doing the children any good being home. And I'm happy to see the parents who are able to homeschool and put their children in private school. And some even learn stuff they didn't even know of what their children were being taught. But still, children should not be home. And I mean, I think they're doing irreversible damage to children, just leaving them home like this, and with some with no intention of going back to school and college.
Well, and sadly, the same people who talk about social justice and all this stuff are ignoring the fact that minority students are going to be set back for years. Huge percentage, never even log on to school day in and day out. And who does it hurt the most? Again, it's people who either can't afford to go to private school, have a tutor, pull your neighborhood together to have teaching pods or something, that those are the people who are suffering. Those kids, the likelihood that anybody under the age of 16 is going to get COVID disease is so minuscule versus the likelihood of the kids committing suicide, doing drugs, hanging out on the street corner. There's no question, risk benefit, go back to school. And I hate to see the teachers unions holding it up. Every time they do something to improve a classroom, they say, oh no, we want more. Now it's an entirely new ventilation system.
Oh.
It's like, what's coming next?
Well, they don't hold new, they have many air purification systems that they can put in these classrooms. We don't need to go and pay billions of dollars to do ventilation. When you've got many safe air purification systems that they can put in each classroom and get these teachers back in, there's so many things that they can do. I think some people have gotten very comfortable being at home, to be honest.
I think so. And there's a technology called far UVC light that apparently does not affect your skin, does not affect your body. And it's a light bar that you can put in for the average size room is $2,000, and it kills viruses. So why aren't we doing that? There's an old expression, simple things are simple, but somehow, the unions and the government doesn't want to go there.
Yeah, and see someone should be shouting that from the rooftop. Whether they would listen, at least they would have no excuse.
Exactly.
They have no excuse for getting that word out and letting this is something that you can do, as opposed to sitting at home and letting these children suffer.
And there's a psychologist who's been speaking out about this, and he just believes that, as well as others, that the damage, depending on the age of the child, can last for years, that it will have some sort of almost like post-traumatic stress disorder.
Yeah, that's it's so sad. Now, I wanted to talk about at-home testing for people who are home that fear they have COVID and they want to do a test at home. Is that available?
There's a couple that have come out, and actually there's a new one that is seeking, or might have just been granted, the emergency use authorization. It's without a prescription, but you have to register it on your cell phone in order to get the instructions and to get it read. So it's not a completely in-home test. Now there's another one that was approved that apparently is more like just doing a pregnancy test at home, where you can do it, get a result, and outside agencies are not involved.
Oh, okay.
I believe that route will get more people to test themselves than the route where you still have to go through and get registered with people and whatnot.
And being monitored.
Yeah, it's one of the fears. You don't want to put yourself on the government's radar screen, because you don't know what they're going to do with that information. If suddenly then, you can't go anywhere. And you've got to give people some credit. Everybody isn't a sheep, that they will use their common sense. If you get a positive test, then you stay home. Then you call somebody and say, hey, will you get my groceries for me? Because it's better to have that, a personal knowledge of a positive test, than to have somebody never test at all because they don't want to be on the radar.
Oh, yeah. So now that test, is it available for people to buy? How do they get it?
I don't know that it's available on the market yet. because the last I had looked into it, I have to say, was probably about 10 days ago or so, and it wasn't on the open market yet. So
Oh,
that's where people have to be careful of which one, because the one that was just granted authorization that you use with your cell phone but have to register is called Everywell. Lucira is the company where it supposedly is more just like an at-home pregnancy test. So, and I think it's Lucira, that you just have to look it up and follow and see where you can get it, if you have to get it directly from the company. And I don't even know the cost. It could be $50, could be $100, likely not more, just from what I've seen.
oh, okay. Now, Dr. Marilyn, now, do you foresee a time where where our government will require people before they can fly, before they can do certain things, to prove that they've been vaccinated?
Oh, what a question. They can't do it in the near future because technically these vaccines are experimental drugs, and under the Nuremberg Code, you can't really make somebody take something experimental. But soon they won't be considered experimental anymore. And then that's when we could have a real problem. And they could do it.
Yeah,
People will fight it. And people are already mounting various legal defenses to it because they know that could be coming. And I think it would be a tragedy to say
yeah,
you have to have a vaccine. I think what would make more sense, even if they were going to do something like that, is say antibody test. Why, if you already have antibodies to the virus, why would you get a vaccine?
yeah. That makes sense. But
I
of
mean,
course, that's just us talking. And
that's right. I'm not in charge of the CDC.
yes, 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 yes. Now, so I know that there, you talked about the different vaccines that people can take, and they have more on the horizon that coming.
The the big one that is pretty close to being out there is called Novavax, which is more of a vaccine closer to like the measles vaccine or some of the ones that people are used to. Um, and a positive about it is it's uses no stem cell lines from old fetal tissue, if that's something that bothers people. So it's a pretty clean vaccine from what I can see that I've read. When it actually comes out, you're going to end up getting more company data and everything on it. But from the preliminary data, it seems to be pretty standard. And there's a reason some of them take longer than others. A lot are, it's just what it takes to produce a vaccine and purify protein and all that sort of thing. It's not that easy to do. And that's why those messenger RNA vaccines came out sooner, because it's easier to make a piece of messenger RNA than it is to actually make the protein that you want to put into a person. So, and the bottles and the needles and all this sort of thing, all of that goes along with the vaccine. And people kind of don't think about that. People are sitting in the lab, the scientists are sitting there developing whatever it is they develop, but then the production people have to deal with what does it take to get a vaccine together. And it sounds kind of silly if you're not in that business. Well, the bottles, but they need particular kind of bottles, and some come in syringes where the medication is already in the syringe, and you have certain kind of needles that are thinner on the inside so you don't lose a lot of the material inside the needle. I mean, and you can see that just when you shoot out anything, or you're washing your hands, there's always something left in the tube when you press the little spigot. And that happens with needles. And over time, if you're giving a bunch of vaccines all day, all the vaccine that's lost in a certain kind of needle you could have vaccinated 25, 30 people. So there's all these little things that go into it that people don't realize, and why you can't just get something out instantly.
Yeah, thank you. Now, I wanted to ask one last question. Now, I heard that people that live in the homeless encampments, is it true that they're not getting COVID as much as regular people? Is that just a myth?
That seems to be a myth.
Yeah.
That yes, homeless people are getting COVID. I think a lot of it, and it's just kind of, is a reporting issue, and that certainly homeless people, and this is years ago, before there's kind of the homeless epidemic, and they were just bums who lived in the street. When I was in Boston, every winter people just died off because they couldn't tolerate the winter, and they'd get pneumonia and die. And I'm sure lots of these folks have other problems, and certainly there's drug addiction, and the whole list of things, problems that not all, some homeless people have. So I think there's probably big reporting issues of cause of death. Now, interestingly, in some of the shelters, they have only 25% of people who test positive. And, there's a certain theory, just like that happened back with polio. Polio was considered a rich man's disease, and poor people tended not to get it because they kind of breathed in it. Polio, even though it was a nervous system disease, ultimately, it was a respiratory virus. So people breathed it in, and people said poor people were breathing in this dirty stuff all the time. And so they had sort of a natural immunity. And at San Francisco General, we used to say this about the bums. They'd come in and have these horrible injuries, and they'd do just fine. It was like somehow they built themselves up, against all these bad things. It was really kind of, we used to laugh about it, but a pampered person comes in and they just fall apart. But so there's a certain logic to, if you're exposed to stuff, that you built some natural immunity. Of course, that's counteracted, that if a homeless person is, obviously they aren't in the best physical shape in the first place. So it counterbalances, but the numbers seem to show that they're getting the disease at the same rate as anybody else.
Yes. Well, my goodness, I am so thankful. Man, I don't want to end the interview. I've enjoyed the discussion, and what you're sharing is just so informative. I'm just grateful, and thank you for coming. But I want you to share your information of how, if you want people to contact you or look you up or whatever, would you go ahead and share how they can do that?
Okay, you can read my stuff and get other information at my website, Marilyn Singleton, MD.JD.com. And I strongly urge you to go to the Association of American Physicians and Surgeons website, aapsonline.org. And on that website, right when you get to the first page, there's a great big picture that says early treatment of COVID. And if you click that on, it'll take you to a page where you can download a little booklet. It's just about 16, 18 pages, and read it through. You can learn a lot about COVID. It's written in simple language, and take it to your doctor and let the doctor see it. A lot of doctors don't even know some of this information, and it might help you to get early treatment if you do happen to get sick.
Oh, that's great. That is so wonderful. I really appreciate it. And I want to thank my audience, thank those who come each week, who listen to these podcasts. I don't take it for granted. Dr. Marilyn, this is a God business here. sharing each week is not something that I would do, not something that I would have done. But, you know, when God speaks, we have to listen to what he's telling us. And he has me out here speaking for some reason, not because I chose it, but something that he gave me to do. And I don't take that for granted either. Now, to all of those, again, I want to thank you, my friends. Thank you. Thank you. Thank you so much. And I want to encourage you to subscribe to my channel. If you like the content of what you're hearing, like it, share it with your friends, share it on your social media, and just get the word out. And this interview, especially, you want to get it out to all your friends because it's great information. And my encouragement to you today is to take a stand. Stand up. First, I say not just stand, but stand for what's right, but seek God. Stand up for what's right, because guess what? If we do not stand up for what we believe and for what's right, who will?